All right, everybody. Today, I'm very excited to have a colleague of mine named Dr. Maria Sokolina. She and I got together because we have a similar mission of promoting sleep health, although we are in different lanes. So it's going to be a very interesting talk today. Dr. Sokolina is a DDS. She is owner of Harmony Dental Art, and she's also certified and a diplomat of the American Academy of Dental Sleep Medicine. She is growing her online presence, and this platform will allow you to get to know her and what options she has for treating your sleep apnea. Welcome, Dr. Sokolina.
Good afternoon or good morning. I'm very honored to be here. Thank you very much, Dr. Wells.
You know, we were just talking off camera about how you came into this space kind of from a personal journey with your own dental issues, and it's totally relevant to what we're talking about today. So can you give us your backstory on how you came to practice dental sleep medicine?
I would say life is all about serendipity, probably. When I was a little girl, my mom, she had two missions. What I have to play piano and be beautiful. It sounds maybe not so relevant, but it turned out really play a significant role in my life. I didn't have any musical ears, so my mom really teach me how to work hard to play piano for 8 years without that. And regarding being beautiful, my mom didn't want me to look like my grandma, who had a really prominent lower jaw and very small upper jaw. So she started orthodontic treatment when I was 4. And it was with a series of orthodontic treatment, and ortho in Russia that time was kind of stone age. They used plaster to take impressions. So I was like a monolith at certain point, and then they used chisel and a mallet to remove that stone from my mouth. And then they did orthodontic appliance, what expand my jaw to give me the better bite or, better look, better smile for my mom, to fulfill my mom's dream. In addition to that, they also released my tongue tie to give me full spectrum of tongue movement and really strong tongue. And I did myofunctional therapy exercise sitting on my father's desk, and I really hated, just like music. But, that's another story. But, it's a lot of perseverance to become beautiful. And I didn't have a clue that time what it's going to become my career. And at a certain point, when I have to choose my career, I choose dentistry because I want to help people and be creative and have my own business. I graduated from medical school in Russia in the dental department. And after that, I moved to United States and I graduated. I have to repeat that education again, but it was totally different flavor. So I did it in NYU. And after that, I did a residency in New York with Israel, and I come across a lot of medically compromised patients. That also was a puzzle. How come we have so many sick people, in front of my eyes at least? And then I start practicing, and then this fear, I had that tremendous fear. I was thinking I'm gonna do the beautiful restorations for people, and they just gonna break it. And doesn't matter how hard I try to use the best materials or how hard I try to use the best setup to do the ortho. I really love moving teeth and giving people bigger smiles. They can still break it if they have obstructive sleep apnea. They would move the jaw forward and break everything what I put so much hours to create.
Yeah.
So it's fear drove me to learn about sleep. And it was many, many years ago. It was more than 15 years ago. I learned about sleep. And I was so excited to protect my dentistry. But there are a lot of pitfalls and obstacles on that road called medical initiative, because you cannot do the sleep study as a dentist. You cannot do the prescription for oral appliance. You need to have a strong communication with the medical doctors. So that's, I become a diplomat for American Academy of Dental Sleep Medicine and start working on my sleep apnea patients. And then I learned what just doing oral appliance might not help. And I incorporate my functional therapy and orthodontics into that treatment. So this is a short overview of that journey, but the main mission for me to connect medical and dental community, what we all can do really creative, helpful things to make our patients sleep and breathe better. So thank you very much for giving me the chance to tell such a long story.
You know, I think it's important to just highlight the potential for collaboration that dentists have with medical providers, because in a way, dentists are so uniquely positioned to have contact with people who are struggling with their breathing. And one of the things that I think is unique about the field of dentistry is that you're very focused on prevention, which I love. And you are evaluating people who are in a dental chair. They are reclined back, and you can see into their mouth about what the situation is, not only with their teeth, but also their soft tissues. Now, a question I get all the time is, I don't want to wear CPAP. What else is there? And you can see behind me, I have all of my lineup of the different choices. But if people are looking to make the move from CPAP to an oral appliance therapy, we're going to talk about this a little bit. So I'm wondering, from a dental perspective, how do you notice that a patient has a problem? What kind of things are you seeing? And you can pull up your slides here because you've got some really great examples that I think will be bringing this home for folks, how to know if they're possibly a candidate for an oral appliance therapy for sleep apnea, and what considerations they're going to have as they move forward and talking to their dentist about this.
It's such a wonderful question, and I'm so passionate about this topic because we have that unique opportunity through the old specialty dentists or dental hygienists or dental assistants, our team or my team. I would say I'm very proud of my team who helped me to have that journey to see so close to our eyes, and as often as every 3 months, signs of sleep disorder breathing. They're not only dangerous for the patients, they're dangerous for our work. I'm talking about dental restorations. It's very unfortunate when you put so many hours, just like I said before, and somebody just break the tooth or break the veneers, and of course they blame the dentist. So you have to be really strategic or dentists have to be very strategic, or patients have to have a knowledge about certain things and ask the dentist if they see any potential danger. So I am gonna use that abbreviation called NEST to show you on a slide what I see very often. Really, from 10 patients, I see it from 10 patients on 3 patients, I see this. And we start with my favorite part called narrow arches. And they look really dramatic. They don't have to be that dramatic. They just have to be narrow with a 40, the distance between first molar and the first molar on the top have to be more than 4 centimeters. So 2 inches,
About 2 inches.
About 2 inches, little bit less than 2 inches.
Yeah.
So if it's less, it's a potentially narrow arches. Why narrow arches are dangerous? Because the narrow arch not gonna have enough room for the tongue, and tongue gonna be happily rested in the airway, especially from my experience. People said sleeping on the back, but I've seen people who has a worse situation with the tongue when they sleep on one of the sides. So it's not 100% supine position or back position. It can be different position what tongue will be rested in the airway. And
yeah, I agree with that. And I just want to clarify for people watching, the arch is sort of the way that the teeth are aligned in the gums, and it relates to how narrow or how wide that cavity is between the teeth. And on the bottom and on the top, you want to make sure there's enough room to accommodate the tongue.
Yes, because you'll see some slides how tongue can be suffering from that.
Yeah.
And enlarged tonsils. Yeah, we call this kissing tonsils. But irony in that, very often tongue is so huge what I don't even see that picture. We have to use tongue depressor to open the airway and see that. Yes, Tonsils, this is extreme, but if they big enough, what you see like a full round face of tonsil, in a throat, that's enough to obstruct the airway when all the tissue become relaxed. And we call it soft palate. That's, if you want to do some explanation, or people would listen to my story, something what's hang behind in the throat. We call it uvula. Very often I don't see that uvula. People have Mallampati score so high because soft palate is hanging so low and tongue is resting so high. Like it's so much crowding in that small apartment called mouth, what I don't even see that. But very often my patient said, in the morning, my throat feels so dry and it's kind of even hurt. And I always want to tell them that's because of that snoring. That's the vibration of your uvula and other tissues all night create so much, movement.
Friction,
Friction, what tissue swelled up. And they can swell up so significantly. And for me, it's so rewarding to see the contrast after I do oral appliance therapy and people stop snoring, how this tissue becomes so small.
Yeah.
Or,
Yeah. And I want to point out, as people are listening, that one of the big myths about sleep apnea is that it's just a tongue problem or it's just a weight problem. So we haven't talked anything about tongue or weight yet. Keep that in your mind, because these are other factors that contribute to risk for sleep apnea.
No, I just want to mention with the weight. So it's wonderful what you mentioned before even we touched that question about the weight. So your weight, the fat distribute in a lot of different areas, including the airway and make airway smaller, and including the tongue and make the tongue bigger. And I do 3-dimensional scan, and I can show people size of the airway, and I can show them sort of size of the tongue. So it fluctuates when people lose the weight. So that's a great topic, and I did not mention on my previous slide. And this one, like from a nest, it's T, tethered oral tissue. And Dr. Wells was surprised to see the slide, how big the bumps under the tongue can be. And thank you for pointing it out. I see it very, very often. Bumps under the tongue and a big bump on a palate. They can be quite significant. And I'll explain how it happens. People really looking for balance. They squeeze the teeth. Some people break the teeth. Some people have pain in the jaw joint. But a lot of times, bone just collect that energy, that pressure, and form that buttress, form those extensions. The bone start growing from that pressure. It's a little bit a myth what we stop growing after puberty. I see people growing all their life, and this is the representation of that. And
the way I understand it is it's the clenching and the grinding that stimulates that bone to grow and collect, which unfortunately perpetuates the problem, because you can see how much this interferes with the tongue getting more space.
But very often I see significant extension of that bone in the case of, we call it tethered oral tissue or tongue tie. A lot of people born with the tongue, like I have on a picture. In the Bible, actually, it was mentioned 3 times. In the past, midwives had a nail, this pinky nail, very long, and they used to cut the tongue tie upon the birth of the baby. Because if baby, in the past time, in the ancient time, before industrial age, if baby cannot get breastfeeded, baby would simply die. But now we have a technology, we have a bottle, so it's a controversial question, as it was mentioned in the New York Times, about tether oral tissue. But this tongue tie not only make a tongue weaker, because tongue cannot move that much, but also promote that bone growth. I cannot tell you exact mechanism, but I see in conjunction with the tongue tie, those buttresses of bone all the time.
Makes sense.
And sometimes tongue even look like a heart from that tongue tie.
Yeah, yeah.
And this is, I love this picture. We call it scallop tongue. People use the tongue to swallow, but instead of the position of the tongue on the roof of the mouth, they push it through the teeth. And then we see those beautiful festoons on the tongue.
And I'm just noticing in this picture too, the teeth are very, they're very cut across. They're they're worn down.
Yes, this is the explanation. When people, TMJ, it's 2 points and the tongue is a third point. If it's like three-legged stool. If TMJ, temporomandibular joint, is not supported by the tongue on the roof of the mouth, a lot of people would grind the teeth to find the balance. And if tongue is not trained enough to stay on the roof of the mouth, they would push the tongue through the teeth. And then we see those festoons. Tongue have to rest on the roof of the mouth flat. Sometimes it's not possible because of the shape of the palate, because originally from the birth, tongue did not form the palate in the correct way due to the pacifier, bottle feeding, and so forth. But in this case, this patient using the teeth to get the balance, and he has that spaces between the teeth because he's pushing the tongue, or she's pushing the tongue through. So we see the scallop tongue. It's a significant sign for potential sleep breathing disorders. And this is my favorite for the dentist to see the mouth breathing. We did not learn that in dental school. And I was, I have a lot of periodontal disease or patient with periodontal disease in my practice. And I was wondering, how come patient, use the toothbrush? How come the tartar or most of the inflammation in the front? Front teeth have a tartar and gum is so inflamed, and in the back it's kind of okay. Later when I start doing sleep, I understand it's the mouth breathers. The air irritate the gum so much, what it's actually inflamed in the front. But as you know, pediatricians, they don't talk about how baby should breathe. And most of my patients, they don't know what should they use, mouth or the nose. It's still a question. And some people said proudly, I have asthma, I have to mouth breathe. And I said, now in addition to asthma, you have a potential sleep apnea as well.
Right, right.
And
can we go back to the picture before? I just want to point out, this is a rather prominent example. This is what I would call on the extreme side. And my question to you is, when I check for this scalloping of the tongue, I most often see it on the sides of the teeth. And it's the impressions of the teeth for that person as they're swallowing or even as they're managing the tongue volume during sleep at night. Is that always a sign of bruxism or clenching, or is it just a non-specific finding?
I would put it towards non-specific findings because when we teach, we have a myofunctional therapy department in our practice. And when we teach people how to swallow, I want them to use the teeth, the top teeth, as a guide to swallow. So if they swallow correctly, in theory, it's still going to be some indentation of the teeth in the back. But if indentations too much in the front, or indentations are kind of specific, that would be the, kind of arrow pointing towards sleep and breathing disorder. But if we take this sign separately, no, that cannot be only one thing. So it's not one thing, it's, several several factors contributing. But this is very dramatic.
It is. Yeah. Thanks for that explanation. That makes sense.
And I'm going to the next slide. And I look at the nose, and very often I see turbinates enlarged. Or another why I like these slides, a lot of people have a very thick alus of the nose, the wings of the nose. And for me, that's the sign of mouth breathing. So people have to use a lot of muscles to get the air through the nose, and they just give up and use the mouth.
Yeah, I see that too. And sometimes it's so second nature. They're not really aware that they're mouth breathing so much. So mouth breathing all by itself can be a reason for poor sleep quality. And yeah, looking in the nose and addressing the nose is really important because the nose was made for breathing.
Exactly. And I call it nasal hygiene. We so used to the topic dental hygiene, but my hygienist used the term nasal hygiene, and she talked to people about nasal hygiene. We constantly recommend people to use nose irrigation in the shape of navash or nail mat with xylitol or saline to make sure nose is clean before they go to bed. Yeah. And I'm very big advocate of mouth taping to teach people how to breathe through the nose. Of course, with myofunctional therapy, we want to make the lips as strong as possible, but it can stay closed during the night. But in the process of it, people have to get comfortable to the idea what they're going to use nose for breathing.
Yeah, agree.
And the last one, also my favorite, called bruxism. And also towards your audience, I want to let your audience know. When I was in dental school and we see patients like this, we call it nightmare, because how are you going to restore? How are you going to do the crowns for teeth so small? Now I use totally different technique, but the main point, my dental school course devoted to this problem was to make a night guard. And I don't want to make your audience bored, but I put on the bottom the article. If dentists propose the night guard, they must have a sleep study before, because night guard occupy the space in the mouth, and it aggravates sleep disorder breathing. And I would say from all sleep apnea, or from all TMJ patients, number would be 70% have signs of obstructive sleep apnea. So, if dentists just give the night guard, and night guard occupy the space, your patient have a right to ask. I think it would be a good idea for me to check my sleep prior, because maybe different night guard was gonna address not only bruxism, but also apneic episodes would be appropriate for the case.
I really want to repeat that for emphasis. So what you're saying is that among people who have bruxism and this wear of the teeth, flattening the tops of the teeth, and even exposing the dentin underneath the enamel, this bruxism problem, people who have that have a 70% chance.
I don't want to say sleep apnea. I want to say sleep disorder breathing, which can be upper respiratory resistance syndrome, which is HI less than 5. Yeah. And then, if we have full story, if dentists have a full story and primary care physician have a full story, then patient make a decision of what treatment strategy they want to pursue. But this is one of the symptoms of sleep disorder breathing.
Yeah.
It's a huge correlation. I don't want to, I don't want to be caught on a wrong percentage, but a correlation between bruxism and sleep apnea, both directions, huge.
Yes, agree. And to your point too, if the dentist makes a bite splint for the bruxism, the space that that splint is occupying in the mouth cavity can make sleep apnea worse. So it makes sense to kind of understand how those two problems can be related and should be evaluated in different ways. But there's also an opportunity for some people to treat both problems with one solution.
Absolutely, absolutely. And I call it to kill two rabbits with one bullet, right?
Yeah.
But it's such a direct correlation.
Yeah, so many ways that the dentists are sort of have an inside view to the airway, looking at the effects that poor airway and poor sleep can cause. I wonder why more dentists aren't sort of informed and working to protect the airway like you are.
Yeah, I lecture for the dentist, and I always want to encourage more dentists to be in this circle.
Mhm.
But a lot of people, airway is a stylish thing. I treat the airway, it's very much in fashion. And a lot of people get signed up for the course, and they take a course, and very respectful course from American Academy of Dental Sleep Medicine. They take the mastery course, but then they come back home and they have two big problems, or at least how I see them. Number one, this is treatment of sleep apnea, not like a night guard. Treatment of
Mhm.
sleep apnea is a medical procedure.
Mhm.
So a lot of patients want the dentist to bill it through the medical insurance.
Yep.
Yes, it's challenging as it is. We have a department devoted to that. And dentists have a different mindset towards insurance reimbursement because medical and dental insurance are two different entities.
Yeah.
So medical insurance is difficult as it is. But also to bill the medical insurance, you have to have a sleep study and referral from the physician.
Mm.
Guess what? We're not part of electronic medical records. We
Mhm.
are outcasts. We have to spend 5 hours on the phone with the medical doctor's office to get this documentation. You
Mhm.
need to have a release from the patient. It's very private information. But we are medical providers as well. It's
Mhm.
just very unfair. But, this is obstacle number one. It's medical insurance and get the information necessary to bill the medical insurance.
Mhm. Mhm.
And then obstacle number two, relationship with the medical community. I love my medical community. Actually, the fact what I'm doing that was due to the several doctors what I'm forever thankful, would make me, who trust me to treat the patients. And from that, I get a lot of experience and, a lot of ways towards the billing and treatment. So I learn a lot. But to start that initiative, I have my favorite story. I'm going to share with your audience. So, medical initiative, I was a new doctor who, start that process, and we do that process in a different way. Of course, building relationship, that's number one priority. How you can build the relationship? You really have to study, or you have to research the person you're going to build the relationship with. We had patient in common. I had my patient who I referred to as particular sleep physician for treatment. The patient came back with a CPAP machine. CPAP machine was in a closet. And
Mm.
regarding the CPAP machine and oral appliance, what I want to say to your audience, those both treatment, they both fantastic treatment. They not exclude each other. And for
Mhm.
certain situation, you need the CPAP machine. And for certain situation, you need oral appliance. We need each other for support. So
Agree.
I start working with this physician who prescribed the CPAP machine to the patient. And he said, don't even think about oral appliance. Oral appliance gonna move your teeth, which is
Mm.
not so true because we as a dentist, we do AM positioner,
Yes.
something what they're gonna wear in the morning to prevent. And second thing, oral appliance gonna cause the pain in the jaw joint. And for that, it might happen because it's a new intrusion and a lot of people clench the teeth, and maybe they would have a TMJ problem even without the oral appliance because it's a big correlation. But, now they have oral appliance, as additional factor. So for that, we give exercise, and people with the exercise, they relieve that and continue wearing the oral appliance. So that's not a problem. But, medical doctor was not aware about that. And I thought, okay, he doesn't have a trust. So I decided to do my medical initiative and invite him to the restaurant of his choice. We had a wonderful time. I came fully equipped with my articles about efficacy of oral appliance and how it can help. With oral appliance itself, I show it to him how great they can look, sleek, and this and that. Then I had my portfolio of sleep studies before and after. I had some cases by that time already. And we had a wonderful time. In the end of the dinner, he said to me, it was all fantastic. I'm not going to refer to you.
How come?
How come? I know CPAP machine works. On a sleep study, it works all the time. You with your dental appliances can dance around, and I'm not against another meeting in a restaurant.
Interesting.
But it's not going to be, it's going to be friendship, and we're still friends. Towards the foodie issues, on a different, different initiative, not related to his patients. But it's not going to be professional collaboration. Because I understand what a lot of medical doctors, they don't have trust in us. Medical and dental school was separated in the 1930s. We have two different tracks. They don't have a clue what's going on in the mouth, or most of the time. And they think we don't know what's going on in the medical office. But that's not true. Because a lot of dentists are very sophisticated, really kind, and passionate about their work. They really want to help the patient, and they really want to collaborate with medical doctors. And that's why I'm so appreciative for the opportunity to talk on your channel. We really want to do that. We really want to help, and we want medical doctor to be our captain. And we want to keep medical doctors in the loop. I send my medical doctors letters on every step, and dentists would do so if medical doctors give us a chance.
I agree with that. And I think the key word that you're using is relationship. You have to understand where the dental provider is coming from and the medical provider is coming from. And there's a real opportunity there to synergize the care from two different viewpoints. And I think that benefits the patient. So I want your perspective on this next question. Because, when I talk to patients about their options for sleep apnea treatment, CPAP being the gold standard, but only if you use it. So if I'm a patient and I think, I don't really want CPAP, I'm interested in this oral appliance, I have a dentist, how can somebody tell if their dentist, who maybe took a weekend course on constructing an oral appliance, how can they tell that they're in good hands with somebody who's going to do the testing after the oral appliance, who knows how to make adjustments, who knows how to sort of communicate with the sleep doctor? How does a patient go about ensuring that they have a good care plan for oral appliance therapy?
I'm going to give different strategy. So not one strategy fits all. Number one, I always, when I have opportunity to give somebody an advice, or I use my channel, sleep apnea, snoring, breathing, help for that reason. So I would say you have relationship with your dentist. You have already those relationships. You have to reach out to your dentist and have, let's call it, interview about that. Patient. The idea what you are your best health advocate. Nobody going to be so passionate about your health, but you are. You have to study the subject. And then you come to your dentist and you said, I suspect I have a sleep apnea. What should I do from that point? Or it might be different story, like patient was most of the time under the physician care and had the opportunity to use the CPAP, and those relationships not forming well. So come to the dentist and explain to the dentist, I have a sleep study. I can talk to my physician and get the referral. Tell me how comfortable you are to do oral appliance. What oral appliances you can offer? And dentist might say, you know, I don't feel comfortable. I don't feel comfortable dealing with the medical insurance. So answer is no. Then we go to second strategy. American Academy of Dental Sleep Medicine have a list of mastery, you know, qualified dentists, people who graduate from mastery program, and list of the diplomats, people who already, you know, got the board done. And there are in every state. Those are qualified people.
Yeah. So the website is www.AADSM, that's American Academy of Dental Sleep Medicine.com. We'll link it in the show notes. And it's one of those things where you enter your zip code and you can choose a radius, and then the website will link you with dental providers who do this and who have been certified. And that's so important. And I also think that when a dentist makes the morning repositioner or morning aligner, that's another sign that they're in the know about how this therapy needs to be appropriate. Finally, everybody needs that follow-up test with the oral appliance in place to confirm that it's working. And this takes place after, you know, you're acclimated to it. But I've run across folks, you know, I'm interested to hear what you say, because I don't think my numbers are huge, but I have seen folks who get the oral appliance made, then they have the follow-up sleep study, whether it's in the sleep lab or done from home, and they didn't improve. And they're very disappointed. What steps can someone take at that point?
Yeah, this is a fantastic question. That's the question what dentists have, that tremor inside, like it's such a scary, you know, I was, you know, when I was getting the letters from the doctor comparing before and after, and then I don't see the improvement. Oh my God, I'm ready to jump the bridge. But that's not so bad.
Don't jump yet.
Don't jump yet. This is the situation. And that's why I want to continuation of your question. Only oral appliance therapy, it's not the answer. And that's how I approach the story. I want to go back a little bit towards how patient looking for the dentist. So dentist, active therapy for oral appliance, usually 3 months. I don't let my patient titrate. It's rare cases when somebody live far. Usually I titrate for them based on questionnaires and snore lab. And a lot of times I recommend
Sorry to interrupt. You're talking about the Snore Lab app. Yes, it's a free app that you can download that will scan for snoring, that noise, and then you can know through the night, better than your bed partner. Don't make your poor bed partner do this. The Snore Lab app will take you through the night to report on snoring. Great resource.
Yes, in addition to that, a lot of people wear wearables. And wearables, you know, I cannot suggest people which wearables to buy, but sleep on ring give you AHI. So if you want to be super knowledgeable about your condition, you can get the wearables, specifically sleep on ring can give you AHI. Now, only oral appliance, you got only oral appliance. Usually when I talk to the patient on initial consultation, we talk about nasal breathing, we talk about open mouth. And I give them adjunctive therapy. I have a whole brochure with the remedies, which I would love to share with your audience, of the links, what I suggest to my patient in addition to oral appliance therapy. Very often I add mute or different type, you know, I don't want to advertise for this company, but different type of dilatators for the nose. Very often I suggest patients to get training with the tape. Very often, I recommend the patient cannot wear the tape, you know, they can wear the tape around the lips, not on the lips. You know, so there are a lot of different remedies in addition to oral appliance. Now, test didn't come up with now, you know, test come up in a disappointing way. And it happened to me for sure. And those are the cases I learned from the most. I start it can be different stories. Sometimes we advance the mandible too much forward and it can collapse. So it can be reverse titration. Sometimes, most of the times, I did not move forward enough. So it is titration or additional, resetting the appliance and moving the jaw forward more. And I usually, when it's not 3 months before the test, for the second test, and it happened, of course, I said to my patient, and I said to the doctor or to whole provider circle, I need to work with this patient more. I'm going to add adjunctive therapy. I'm going to offer myofunctional therapy to breathe through the nose, to keep the lips together, to make the tongue stronger, swallow with the tongue, keep the tongue on the roof of the mouth. So that can improve the AHI for repeated sleep study. I said, I need a little bit more time to work with this patient. I usually said, I need 6 months. And the dentist obligated by American Academy of Dental Sleep Medicine and standard of care after the active therapy, see the patient every twice a year on the first year and once a year afterwards. But if sleep study came not successful, then we take a deep breath and we continue the therapy until the second sleep study. And of course, just like with any therapy, therapy might not work, but dentists have to do as much as she or he can to make sure it works, or we can improve this, we can improve nasal breathing, we can improve, muscles, lip muscle strength, we can improve the tongue position, we can improve the sinus situation, which play the big role. Allergy medication plays a significant role. So when I get unsuccessful sleep study, to answer your question directly, I go fully back and start looking at the different factors. But formula is not simple. Formula become complicated. And, dentists who don't feel comfortable, that time they have to refer to somebody who feel more comfortable and knowledgeable.
Yeah.
And that's a practice.
Yeah, I think that is one reason of many that having an experienced dentist is absolutely key to success. Because if you hit an obstacle, if you hit a roadblock like this, you have to know how to pivot, how to figure out the problem. And to your point, you can be over adjusted with the forward movement. You can be under adjusted so that more forward movement is necessary. You can work on the nasal breathing. You can use the nasal valves. I've even used breathe right strips, adding that to the regimen, seeing an ENT doctor, position therapy in addition to the oral appliance. All of these things require the experience and knowledge of a seasoned and certified dentist. So thank you for laying that out.
Yeah, I just want to add, sometimes we need to do orthodontic treatment. We need to expand the crowding. We need to create more space. It might not be such a simple answer, but if somebody devoted, that's we can find a way to work with that. That's why I create the community sleep apnea, snoring, breathing health. When I try to reunite specialists of different areas as well as the patients. But if you have a difficult circumstances, you can describe and we definitely get back to your chat. Or maybe I'm going to do the program. Just, sometimes I do program just myself without the interviewer, like I did on TMJ and surgery recently, or different remedies. But I can explain what should be done to address that. Yeah. So if, I would be very honored if your audience would check my channel, Sleep Apnea, Snoring, Breathing Health. I hope I put enough practical information as well as your interview.
Yes, and this is all free information. It's from a reputable source. It's great to understand why this is so important, because sleep is absolutely critical to health. And on that note, I want to wrap up. I wonder if you can give your website, your practice location, in case there's people near to you, and then also reiterate your online presence and free resources so everyone can know where to find you online.
Yeah, I would be, my name is Dr. Maria Sokolina. You can find me by Googling Harmony Dental Arts, and we have a special sleep apnea website. it would show you with my name, Dr. Maria Sokolina. And you can find me on the Facebook, Sleep Apnea Snoring Breathing Help, on the YouTube, on the LinkedIn, and on Instagram under my name, Dr. Maria Sokolina. So thank you very much. I really appreciate your time.
Fantastic. Thank you so much. And here's to good sleep. We'll see you soon in Houston.